we have been depending a lot on cereals and pulses as major source of energy. It's fine, but at the same time, we are also seeing that the proportion of diabetics in Indian population has increased like anything, partly because of our poor lifestyle, partly because of overeating. But don't you think that the proportion of carbohydrates in our traditional food is far too in excess?
Well, that is again a misconception that the industry has succeeded in making us believe in. Diabetes is a multifactorial problem, and you in fact touched one of the most important things when you said that it is because of overeating. It is not because of what we eat, it is because we eat more than we need. Now, there are two ways of approaching that. One is we take very little exercise and we take very little food. The other is we take a reasonable amount of food and also take a reasonable amount of exercise. The second option is better. Eat well and exercise.
Yes.
And what will tell us that we are doing enough? To some extent, the body weight. So simple things, but at the same time, and again, I mean, I don't know what that book says, but then there are people coming up with these sane voices also. The other day, I picked up in Dr. Bhaswati Bhattacharya's slides, one little book. I think one can search on the internet what that book is about. The low carb fraud. This popularizing of low carbohydrate diets itself is a fraud, because if you take low carbohydrate, you'll either take low protein or you'll take, high protein or you'll take high fat. So that is how you can promote at least high protein diets, which means that you'll have to turn to protein supplements. So there's a whole book now, it seems, the low carb fraud. Once there was a patient that reminds me who once asked me, I have diabetes and my doctor says take a low carbohydrate diet. I also have heart disease and my doctor tells me take a low fat diet. I also have gout and that doctor tells me take a low protein diet. So low carbohydrate, low protein, low fat. What should I eat? Told him eat everything. Eat everything in moderation. Eat a proper balanced diet. That's all.
Thank you, sir.